So egg freezing has become more popular in the early 2000s until 2010. Egg freezing was considered experimental, but nowadays it's considered a conventional treatment because the success rate has been proven. In general, egg freezing is recommended for anyone that is not ready to have a baby and they're approaching their 30 or 35-year birthday. In addition to that, anyone that's undergoing chemotherapy or any kind of surgery that may affect their egg reserve, we recommend that they freeze their eggs in case the treatment decreases their egg count for future use. And also patients that want to just bank eggs before getting married or before going to school, just in case they don't get to have a baby for a while. They freeze their eggs so their mind is at ease, so they can focus on their job or school until such a time they're ready to have a baby. When freezing eggs, we usually recommend to freeze at least 15 to 20 eggs for each baby that you want to have, because once you freeze 20 eggs, when we unfreeze them, maybe 18 or 15 will survive. Then when we fertilize them, maybe 10 to 12 will fertilize, and then as we grow them to embryos and genetically test them, they end up with 2 to 5 normal embryos, and then once we transfer those 2 to 5 embryos, hopefully that will result in 1 or 2 normal babies. In addition, when you freeze eggs, we always recommend that you become pregnant or have your surrogate mom, if you choose to use a surrogate mom, become pregnant before you hit age of 40. Because when you're young, if we use those embryos and it doesn't result in pregnancy, we can still get eggs from you and use that to achieve a pregnancy. But if you wait until you're 44 years or older, if those frozen eggs don't work, then you lose your chance of having a baby with your own genetic material. So two things to keep in mind is, one, the number of eggs that we want to freeze, and two, the timeliness of when we want to use those eggs. So if you're thinking about egg freezing, we highly recommend that you come in and do some basic testing to make sure, first of all, how your egg reserve is, and then discuss treatment options that will make this process successful and seamless. Please contact us and we'll be happy to talk.